Hey all, Eric Christensen here from meded101.com. I'm excited this week. I'm giving a talk to a bunch of nursing staff and nurses about some of the challenges with the opioid crisis that's going on. And we're going to talk about chronic pain, we're going to talk about addiction, and we're going to talk about drug diversion as well, particularly drug diversion within healthcare facilities, long-term care facilities, assisted livings, and so on and so forth. I've got extensive experience in working with that in my job as a consultant pharmacist. There probably wasn't a month or two that went by where I didn't get a call, an email, simply just chatting with the director of nursing about a potential issue, discrepancies of controlled substances and things along those lines. So wanted to cover two really important points to kind of simplify controlled substance tracking and monitoring. The first one is limited access. Okay, that's one sure way to help prevent drug diversion or at least catch it sooner. So limited access is the first important point you got to remember. And I don't mean limited access in a policy and procedural type of method. I mean it in an actual sense. So let me explain that a little bit. So example number one, had an individual that understood that a nurse left the medication cart open frequently when she stepped away. And this particular individual had it timed out. They knew when the nurse was doing a dressing change for a specific resident that took a long time. And at that time, that individual was able to steal medications out of a medication cart. So that's one kind of classic example that I have come across in the past. Another example of thinking about limited access is those medication carts that have passcodes and or keys. So leaving the keys laying around or in a hidden drawer that everybody knows that's where the keys are, not appropriate. We're not limiting access by having a system like that. Same thing with the punch codes. If those numbers are so worn out on the punch codes to get access to the medication cart, well, maybe it's time to switch that code. Same thing with individuals watching staff members punch in that code to get access to the medication cart. We've seen scenarios of that happen as well. So limited access, number one, first thing you should think about. Number two biggest thing you can do to kind of limit and try to prevent and catch drug diversion quickly is, of course, auditing. So this is the process of basically checking how many pills, tablets, patches, whatever you've got, basically comparing that to a log or a registration sheet and matching that up and making sure that makes sense. So one big mistake I see there in auditing is staff who simply look at the book and then they actually look at the medication card and say, yep, that's about right. Okay. So when you're doing that with two people and having two people sign, you want to make sure that the staff member looks at the medication card and says, yes, there are 23 tablets of oxycodone 5 milligrams in here. Then the person holding or looking at the book or count sheet, they can say, yes, there are 23, or no, there aren't. Versus the other way around, you can tend to get a little bit sloppy and get into a hurry, which I've certainly seen staff do there. So first is limited access, second is auditing, and obviously the more we count that medication, the more often we can do that, the better accountability we're going to have. So, and this is a logistical challenge for sure. Staff have to do what they do and take care of patients, but the more frequent we're able to count and track those medications, it really narrows down the time frame if a discrepancy is identified. So an example I've seen that's come into play, as needed medications, so let's say a tramadol, an opioid, a Schedule 4 opioid, and maybe policy and procedures in place, and there's nothing in place other than to count as you use that medication. Well, that medication could sit on the cart for 3, 4, 5, 6 months and not be used. And in the event that somebody goes to use it, okay, now we can't find that card, all of a sudden you have 3 months, anywhere in the time frame of 3 months that could have elapsed and passed by, that card could have been taken or stolen. So again, that auditing, having good procedures in place, reasonable procedures in place. Obviously, we can't count medications every hour or something silly like that. So yeah, limited access, auditing, two basic principles you need to understand as far as monitoring and tracking controlled substances. So hope that helps out. If you go ahead and like this video. If you got any comments, questions, if you'd like other videos on long-term care topics or geriatrics or anything like that, certainly I'm open to that. Find me at meded101.com. Hit the contact button and shoot me an email if you've got any comments, questions, or concerns. So again, looking forward to the conference this week, speaking to a bunch of nurses, and hopefully those 2 points will help you kind of simplify the process of controlled substance accountability.